on this potentially big announcement here. Our science and tech correspondent Ariel Levine-Waldman joins us now here. Ariel, been talking about this for some time, and it's been no secret that this secretive institute is doing this vaccine research here. But what does it mean now, going into human trials? How significant is that?
So let's first break this down into a few parts. What does it mean to go into human trials? Human trials is what happens after animal trials prove that you can get results without severely damaging the animal test subjects. When it goes into human trials, it means it's deemed safe enough that you can start seeing, does it work on humans too? And the first stage of clinical trials is just this microscopic amount of people, just a handful, about 60 or so people for the first month. And then after that, starting in December, if it works on the first 60, they're going to expand that to 960 people. And now you can finally start to see, very good, it didn't poison anybody, but now we can extrapolate the data set over a large number of people and start figuring out what percentages have a reaction. Once you've determined that, then starting in April or May of 2021, they want to go into phase 3 trials. This is going to be 30,000 people. That's when you go, okay, we have our percentages. Now, can we actually scale it over a widespread population? And what happens at a population-wide scale? If this test is successful, it proves that they have a working vaccine without any serious downsides or drawbacks that can be mass-produced, and 15 million doses can be spread among the Israeli population and, according to the defense minister, Israel's close neighbors.
Now, where does Israel rank? I mean, in terms of this time frame, the research, what we know about it, where does Israel rank in terms of the race for the vaccine worldwide? What are other countries doing right now?
Look, if we're racing for the win, we're obviously not going to be seeing the victory here in Israel. The question is it enough to be first? And that has been a major discussion over the past few months. Israel is certainly behind China. It's certainly behind Russia. It's certainly behind the United States and England, all of which have budgets that massively dwarf Israel's, and they can sink tens of billions of dollars that Israel simply doesn't have into projects like this. Under that circumstances, under that logic, there's no way Israel was ever going to be first to come up with the vaccine. But there is the secondary part. Just because you're first doesn't mean you have enough for your population, or more importantly, just because you're first doesn't mean you have enough to export to other populations. The United States is planning on securing its own citizens first. That's 330 million people. And depending on how many doses you need per person, that's at least 500 million doses you're going to need long term. China is in a similar situation. Russia is in the same. At the very beginning of the COVID outbreak, we saw every single nation on Earth scrambling to get medical supplies and really backstabbing, double dealing, and bringing the full weight of their industrial espionage apparatuses down just to secure medical equipment. Why would that not happen with the vaccines once they come to market? There are upwards of 7 billion people in the world, and every last one of them is going to want a vaccine. And there's no way you're going to have more than 7 billion doses provided over the next coming months. A domestic production is of critical importance, thus.
So it sounds like temper the excitement a bit, but obviously positive development nonetheless here. Ariel Levine-Waldman, thanks for being with us here to break it down.